Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.
You're listening to Healthcare Matters, the podcast that pulls back the curtain to help you make sense of complex healthcare economics and policy issues. With us, as always, is Dr. Robert Popovian, joining us from Washington, D.C. He's a pharmacist, economist, and the Chief Science Policy Officer at the Global Healthy Living Foundation.
And joining me is my good friend, Conner Mertens from Seattle, Washington, my co-host and our patient advocate and community outreach manager. Yes, and I'm going to be the first one to admit it. Seattle Seahawks are in first place for the NFC West. Unbelievable.
All the way to the Super Bowl, Robert. All the way to the Super Bowl. And thank you for listening to us and for all the positive feedback. Let's start with a listener comment. This one comes from James C., who writes, "Thanks for bringing some clarity to the mountains of health information out there."
Keep the feedback coming, and as always, make sure you spread the word by rating our podcast or writing an honest, positive review. We really appreciate it. And we want to be the first ones to tell you that our next episode is going to be a mailbag episode where we're going to ask you all, our listeners, to send in questions to us. And we're going to try to address as many questions as we can. And our esteemed producer, Ben Blanc, is going to be moderating that session between Conner and I.
Hey, we're really looking forward to this mailbag episode. So to participate, make sure you send your questions to healthcarematters@ghlf.org, and you might be featured in next week's episode.
So now let's get into this week's episode, Conner. So, Conner, today we're taping this podcast on November 8th, which is Election Day. So let's start the discussion with me asking you a question. What do states of Oklahoma, Georgia, Illinois, and Washington have in common?
Like you said, it's Election Day. My brain's a little mush right now, so I'm going to guess that's our ideal college football playoff scenario. I see you got Washington State in there. Go Cougs.
Maybe not this year. You know, the Oklahoma is struggling. Washington State is doing okay. And Georgia definitely will be there. But no, these four states are the states that have passed accumulator or maximiser bans. That means to protect patients' out-of-pocket costs, this legislation was passed in these states to allow any kind of a patient assistance program that comes from anywhere, whether it comes from the pharmaceutical industry, foundations, and so on and so forth, to count towards a patient's deductible or their out-of-pocket requirements. So that's what the commonality is.
Okay, Robert, that makes sense. So this episode, we're going to be diving into kind of what's on the horizon potentially to look forward to legislatively after these elections. Obviously, we're kind of taking stabs in the dark. We're not really sure what's going to happen tonight. But as you were mentioning offline, issues for patients don't go away despite who's sitting in office. So why don't we get into this? What are some issues that we're thinking about federally that patients should pay attention to this year?
Okay, well, we need to continue, Conner, helping patients with their out-of-pocket spending, right? There was some stuff that was done through Congress for Medicare patients that helped them, cap their out-of-pocket costs for Medicare Part D, as well as zeroing out-of-pocket costs for vaccines for elderly. But now we need to help everyone, right? So one of the main issues that we need to revisit is why can't patients benefit from multi-billion dollars of concessions that are given by the pharmaceutical industry to the PBMs and the insurers at the point of sale when they go to a pharmacy. And that's one of the things that we need to start thinking about is how do we help the patients with those things?
A good place to start then, Robert, is can we remind folks what is a PBM, what is a pharmacy benefit manager, and why are they being the beneficiaries from these rebates rather than who you would think, which would be the patients themselves?
So, Conner, PBMs or pharmacy benefit management companies are multinational organizations that set up benefit design and negotiate on behalf of patients and employers with pharmaceutical industry to create coverage decisions for drugs. These companies negotiate multi-billion-dollar contracts in concessions and rebates and fees and everything else. And unlike any other segment of the healthcare system where the insurers negotiate with hospitals or physicians or optometrists or dentists, and that the patient directly benefits from those negotiated prices, in the pharmaceutical industry, in the biopharmaceutical market, all of the concessions are primarily being pocketed by PBMs and insurers, and very little, if any, money is passed back directly to the patients at the point of sale when they show up to the pharmacy counter.
So a priority of this next Congress has to be, that two-pronged piece, which is passing along, these concessions and the rebate savings, but also transparency, right? Like we don't know what's happening, or these PBMs aren't required to be transparent about the way that they do their drug pricing. Are these two ways? Are there things happening in Congress now that we can look forward to? Or is this something that they're going to have to pick up the mantle and recreate the wheel?
I think Congress has been talking about transparency for a long time. And you bring up a good point. I mean, without transparency, we don't even know what the exact numbers are, right? One of the questions always comes up, what is the price of a medicine? Well, the price of a medicine is whatever the sticker price is, but that's not what the insurers and the pharmacy benefit management companies, employers, or anyone else pays. It's primarily the person who's uninsured walks into a pharmacy, and that's the person who pays that price. So first and foremost, we need to figure out how much money is collected by these entities from the biopharmaceutical industry and how much of it flows back to the employer, to the government, or to the patient, which is the most important recipient here, right? And has the Congress done anything meaningful to create transparency in this marketplace? Not necessarily. There's obviously investigations being conducted by the FTC in this topic of how much money is being pocketed by PBMs and insurers and the entire insurance model that currently exists. But currently on the federal level, we have very little impetus or any kind of legislative effort to create this transparency that needs to occur first.
So to the many, many members of Congress that tune into our podcast, we want them to know that get to work on these transparency laws. What are some other ways that we can be addressing, biopharmaceutical company pricing?
I think one of the best ways to do on the federal side is to create an environment where biopharmaceutical industry has a stake also in the outcomes of these drugs, right? So instead of just setting a price, getting paid for it, they need to make sure that these drugs work in the patients. And there are methodologies like outcomes-based contracting that need to be implemented with certain classes of drugs to make sure, as I say always, that the pharmaceutical gets to provide the necessary outcome that it has promised. And if it doesn't provide the necessary outcome, then they cannot be paid for that medicine. So those are the type of things to keep the pharmaceutical industry's feet to the fire and make sure that they are providing medicines that will provide benefits to patients, and those benefits can be captured and then they will be reimbursed accordingly.
One thing that we've discussed before is, what these laws and this legislation can do to innovation in the marketplace and around new drugs and therapies. What can our next Congress do to maintain and ensure we continue to have innovation in the medical fields while still making sure that patients are going to benefit better?
I think, as I said, you need to make sure that the flow of money is known, of where the money is collected and where it goes, because then you can decide whether or not the villain is the pharmaceutical industry or the pharmacy benefit management company or the insurance company, or perhaps the employer who's not sharing these savings with the patient at the point of sale. That's the number one thing. The second thing that they can do is to ensure that the pharmaceutical industry is healthy and the marketplace is healthy, so that when crises like the COVID pandemic happens, they're able to step up and bring innovative medicines into the market quickly to be able to then manage diseases that we may not even know about at this time.
Well, there's always work to be done on the federal level, but I'm curious, what do you think are priorities that we'll see at the state level? Obviously, 50 different states, 50 different legislatures, 50 different priorities, systems of Medicaid, Medicare. I know I'm asking a very broad, but what do you think state legislatures should be focusing and fighting for this next session?
Right. So on the state level, that's where the action is usually, right? Conner, you and I have experienced this. And what we've seen in the state level is, number one, the rule of transparency is much more applicable. There's multiple states that have passed legislation that require transparency about how much money is collected by the insurers and the PBMs from the biopharmaceutical industry and how much is passed back on to the plan sponsors or to patients. State of Texas comes to mind. There are states such as California that have mandated to see what is the spending towards premiums that occurs for biopharmaceuticals. So that's another thing. But the most important thing is the question that we started with, right? The states of Oklahoma, Georgia, Illinois, and Washington, and several other states that have passed bans on maximisers and accumulators. These are programs that do not allow patients to benefit from any of the patient assistance programs, because what the PBM does is that does not allow through these programs for this money that comes from the patient assistance program from the biopharmaceutical industry to apply to the patient's deductible or to their out-of-pocket cost requirements. Most importantly, though, we need to look further along. So certain states, including state of Texas, have passed laws regarding prohibition on steering patients. And what is patient steering? Is that when a pharmacy benefit management company requires a patient to go to their PBM pharmacy. And by doing so, they're making sure that they capture all of the concessions and all of the stuff that they get from the biopharmaceutical industry. And let me tell you, they don't pass all of that back to the plan sponsor. Anti-steering legislation, such as the one that passed in the state of Texas, allows a patient to go to any specialty pharmacy that they want to in the state and does not mandate them to go to the PBM-owned specialty pharmacy. Remember, 80% of specialty pharmacy ownership is through pharmacy benefit management companies. And that's important. So they not only control the retail marketplace, which is the pharmacy you and I go into and walk in and get our prescriptions, but they control the specialty pharmacy marketplace, which is far more lucrative with regards to all of the concessions like rebates and fees, because that's where the dollar amounts exist. That's where the brand name medicines live. So, Conner, what about you? I mean, you talk to our patients every day. What do you hear that they want to see changed come this new Congress or this new era of governorships in both the state level and the federal level? What do you hear from our patients?
Yeah, I mean, luckily, I think you truly do have your finger on the pulse, because I'm hearing a lot of the same issues that you've brought up today. Obviously, you can get a little more niche than some of our patients, but what we're hearing is they just want cheaper medications. They want to be able to get access to their doctors quicker. They just want better and more accessible healthcare. And quite frankly, I'm glad that, you're here and we're here to dig into how that happens in the background, but ultimately, they don't care how it happens. These are their lives that politicians are playing with. And at the end of the day, they just want to be able to have a healthy life that isn't going to cost them their life savings. So that's, I think, kind of thematic of what I've been hearing across the board.
And Conner, I couldn't say it better, because when we think about politics and patients, and we have a rule in our podcast, right? Healthcare is bipartisan. Access to healthcare is a bipartisan issue. Trust me, cancer doesn't care if you're a Republican or a Democrat. Access to medicines, the way the medicine works for a patient, is irrespective of your political leaning. Therefore, all of these things that we just talked about are a continuation of things that we need to fight for as an organization and through people like you who work with our patients directly. Because at the end of the day, whether it's a Republican Congress or a Democratic Congress or a Senate or a governorship, doesn't matter, because the patient issues of trying to get healthier, to be kept healthy, and to be able to access medicines and physicians and hospitals is the same. And both parties have a responsibility to patients to be able to get them better, quicker, faster, healthier. And unfortunately, that's not the way we view healthcare in our political ecosystem. And that's a shame. And it's to the detriment of the patients.
Well, Robert, that's a hell of a last word. Thanks for breaking it down for us. I think that's some very valuable information for folks in this next upcoming year with a lot of uncertainty in politics. At least they got you.
Well, they have us. They have you, they have me, they have Ben, who's producing this podcast, and they have Global Healthy Living Foundation and everybody who works in GHLF. But at the end of the day, it takes a village. And at some point, doesn't mean anything if you're a libertarian or you're conservative or a liberal or a Democrat or Republican, you are going to get sick. I have news for you. And at that point, you're not going to care about politics. All you're going to care about as a patient is to get better. And as a healthcare professional who has worked with patients in the past, all we care about as healthcare professionals is to help those patients get better. And that's where we need to focus our attention on.
Well, again, thanks for breaking that down for us, Robert. And to our listeners, don't forget to subscribe to our podcast on Apple, Spotify, or wherever you might be listening so that you'll never miss an episode. If you have a minute, Help spread the word by rating our podcast, writing a positive review, and sharing with your friends and family. It'll help more people like you find us.
And to our listeners, don't forget, we have our mailbag episode coming up next. So please send all your questions. And if you don't want to send the questions, send an audio clip to healthcarematters@ghlf.org. And we will try to answer as many questions as we can. And we're going to get Ben involved, and he's going to come on, and he's going to moderate this session. And we're going to have a hell of an episode, and you're going to have fun with this. Okay, Conner, so before we head out, I want to make sure that all of our listeners know about the other great podcasts on the GHLF Podcast Network.
That's right. Actually, the last episode of Talking Head Pain, our colleague Joe Coe was joined by Michelle Tracy. She's an advocate, a writer, and also a migraine patient who has been very open about her journey with migraine and mental health on social media. If you haven't done it already, make sure to give it a listen. It's a really good series. And remember that you can find all these GHLF podcasts at ghlf.org/listen.
And you know, Conner, that episode actually I have listened to. And one of the things that it reminds me of is that please voice your opinion. Please let us know how we can help. GHLF is here to help patients. And if you need help, reach out to us. We are able to help you out, and we will do so as any way we can.
Well said, Robert. Well, thanks for tuning in. As always, he's Dr. Robert Popovian.
And he's Conner Mertens. We'll see you all next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.